My topic is roth spots and infective endocarditis. The definition: infective endocarditis is defined as an infection of the endocardial surface of the heart, which may include one or more heart valves, the mural endocardium, or a septal defect. Its intracardial defects include severe valvular insufficiency, which may lead to intractable congestive heart failure and myocardial abscess. If left untreated, infective endocarditis is generally fatal.
Hey, this is Dr. K from my medical school, and today we're going to talk about infective endocarditis. Just to highlight the important points, anytime you see this light bulb in this presentation, it means the material is highly tested, and in the words of one of my medical school professors, know that. So let's start off, as usual, by asking what is infective endocarditis? Well, infective endocarditis is a microbial infection of the heart endocardium. The heart consists of 3 layers of tissue. The outermost layer is the epicardium, then the myocardium, and finally the innermost layer is the endocardium. The endocardium tissue covers all structures within the heart, including the valves and the chordate tendon. Just as a refresher, the valves are like a parachute that regulate the movement of blood from chamber to chamber, while the chordate tendon are the cords that hold the parachute or valves open. Now that we know what infective endocarditis is, we need to understand what are the risk factors for infective endocarditis. Risk factors for infective endocarditis include poor dental hygiene, intravenous drug abuse, hemodialysis, long-term indwelling catheters, diabetes mellitus, and prosthetic valves.
The applications in medicine. The symptoms, there are petechia, they are common but not specific. The smooth splinter hemorrhage, there are dark red linear lesions in the nail beds, ossular nodes, tender subcutaneous nodules usually found on the distal pads of the digits, and Janeway lesions, there are no tender maculae on the palms. Let's see another video.
Bacteria and other pathogens constantly enter your bloodstream. Sites of infection, injuries, mucous membranes, and even while you brush your teeth. Bacteria are a danger to the inner lining of the heart, the endocardium, and the heart valves. They can cause destruction, abscess, perforation, heart failure, uncontrolled infection, and eventually
the diagnosis. Let's see first a video.
The bacteria which you grow, it's a pretty aggressive bacteria that in literature, it's really rarely one of the causing events because it's right back on this apoplectic. She's really a cold flora. When I was talking to her, she said that sometime in October, a couple of her relatives got some sore throat. She was around them, so apparently I think that she got sore throat and then having most probably got taken for another valley and maybe some damage which I must be off, she harbored infection. I was searching for a new thing to do in the sense of how we should replace this valve without going to the heart, foreign tissue like synthetic tissue. Okay, and then I came with this idea because we do this operation on the aortic valve, so we replace the aortic valve with the aortic homogram. And I said, okay, what will happen? Just turn the valve and do some mechanic job and just fix it and it worked. It worked very well. She's not participating in all the activities which she had pre-operation.
Like the diagnosis, the diagnostic criteria developed by Durrett and colleagues are generally used to make a definitive diagnosis of infective endocarditis. The criteria combine the clinical, microbiological, pathological, and echocardiographic characteristics of a specific case. The pros and cons are not difficult to diagnose, easily to treat in early detection, and could lead to other fatal disease. Could be fatal if diagnosed late. Should apply in the A 40-year-old woman from Ecuador diagnosed with a complex congenital heart disease was admitted complaining of fever, chills, night sweats, and productive cough 6 months after surgical correction of the anomalies. An echocardiography showed vegetations located on the interatrial pericardium patch. To the best of our knowledge, this is the first reported case of post-operative infective endocarditis on this location. Let's see a video.
My heart's feeling off, and I'm having other unexplained physical issues.
Do you know what infective endocarditis is?
No, but it sounds like a simple infection.
Actually, it's an infection in the heart caused by bacteria that lodged in the endocardium. It could be very dangerous.
Sounds bad. What causes it?
Congenital defect, rheumatic fever, replacement of the heart or valves, repair to the heart, hypertrophic cardiomyopathy, previous episodes, intravenous drug use. Bacteria can get in from urinary tract infection, pneumonia, skin infection, periodontal disease or surgery, colon cancer, tooth extraction, teeth cleaning, tonsil removal, prostate removal, unsterilized/contaminated needles.
That's awful. What?
For the conclusion, it is an inflammation of the lining of the cameras on the heart valves. Fever, chills, and sweating are the classic symptoms. General patients need therapy from 4 to 6 weeks to completely eliminate all bacteria from the heart chambers and heart valves. Antibiotic treatments that start in the hospital should continue at home. Let's see the last video.
In this video, we're going to talk about endocarditis. And endocarditis is basically a bacterial infection of usually the heart valve. So if we were to draw a very basic diagram of the heart chambers, left atrium, right atrium, left atrium, right ventricle, left ventricle. The heart valves are of course, these areas that I'm drawing. So this one here is your tricuspid. This one here, of course, is the mitral valve. This one here is the pulmonic valve. And finally, that one is aortic. And these valves allow blood to flow from one chamber to another, and they open and close. Now, the problem is that sometimes these valves can become infected with bacteria, and when that happens, it's endocarditis. Now,
Thank you.